Welcome to This Explainer. Today, we are strapping on our detective hats and decoding the true source of your knee pain. I mean, if you've ever felt that sudden, sharp twinge when just squatting down to tie your shoes, or that frustrating stiffness when getting out of a chair, yeah, you are absolutely not alone. We're talking about one of the most common joint complaints that literally affects millions of people every single day. But here is the absolute most important thing you need to know right off the bat. Knee pain when bending is not just something you have to grit your teeth and live with. By understanding the clues your body is leaving behind, we can track down the exact culprit and find a real path back to a pain-free life. So let's get into it. Okay, let's dive into this. Here's our roadmap for today's investigation. First, the mechanics of bending. Second, 7 common pain causes. Third, decoding your pain clues. Fourth, finding relief at home. And finally, when to see a doctor. Section 1. The mechanics of bending. The inciting incident. So why does it actually hurt to bend? I want you to think about those visceral, sharp twinges or those deep aches you feel during totally normal stuff, like tying your shoes or climbing a flight of stairs. You know, your knee is an incredibly complex piece of biological machinery. It's like a giant puzzle. You've got the thigh bone, the shin bone, the kneecap all interacting, held together by these super strong ligaments, cushioned by cartilage, and powered by tendons. Every single time you bend that joint, the kneecap has to slide perfectly in its groove, the cartilage compresses, and the menisci, which are basically your built-in shock absorbers, get squeezed. When any single piece of this complex system breaks down, gets irritated, or wears out, well, that everyday bend is going to trigger a very real, very noticeable pain response. Now, what's really interesting here is the sheer physics of it all. It is fascinating. During normal walking, the forces acting on your knee joint reach about 2 to 3 times your body weight. Not too bad, right? But when you do something as simple as squatting down or climbing stairs, that force multiplies to up to 7 times your body weight. Literally 7 times. When you put that kind of mathematical load on a joint where, say, the cartilage is thinning or a ligament is a bit irritated, it completely makes sense why the simple act of bending becomes the inciting incident for your discomfort. Section 2. 7 common pain causes. The usual suspects. All right, let's line up our usual suspects. These are the 7 most common culprits affecting millions of adults every single day. We've got osteoarthritis, meniscus tears, patellotendonitis, runner's knee, MCL injuries, IT band syndrome, and Baker cysts. Let's interrogate them one by one. First up on the lineup is osteoarthritis. Honestly, this is the heavy hitter, the most common cause of knee pain when bending, especially for anyone over 45. It's fundamentally a wear and tear condition. Over time, that protective cartilage that cushions the ends of your bones, it just gradually degrades. And as it wears away, the bones literally begin to rub against each other. Ouch, right? This leads to a deep, stiff, exhausting ache that definitely gets worse with activity. And to put this into perspective, about 19% of older American adults deal with this. It's also worth noting that women are actually at a higher risk here, partly due to hormonal changes after menopause. Next suspect, the meniscus tear. Remember those shock absorbers we talked about earlier? Your knee has 2 of these C-shaped pieces of cartilage called meniscus. Now, a tear often happens from a sudden twisting movement while you're putting weight on it, like pivoting really hard on a basketball court. But here's the catch. In older adults with worn-down cartilage, just everyday wear and tear can cause a tear. The telltale signs, you'll probably feel a sharp pain, maybe hear a pop, or get this deeply unsettling feeling that your knee is just locking up or giving way completely. Our third and fourth suspects are all about activity and alignment. Let's talk about runner's knee, technically known as patellofemoral pain syndrome. Now, spoiler alert, you absolutely do not have to be a runner to get this. It develops when your kneecap doesn't track properly in its groove, creating all this abnormal pressure. And there's a fascinating hallmark symptom for this called the movie theater sign. It's basically an aching pain around or behind the kneecap that actually flares up when you sit for long periods with your knees bent, exactly like you would at a movie theater. Then we have IT band syndrome. So your IT band is this thick band of tissue running down the outside of your thigh. When you bend and extend your leg over and over again, this band can rub against the outer lower edge of your thigh bone. That friction creates a very distinct, burning pain on the outer knee. In fact, outer knee pain almost always points to IT band syndrome. It develops gradually, and we see it a ton in distance runners, cyclists, and folks who just jumped into a brand new exercise routine. Interestingly enough, you'll really feel this pain flare up when you're running downhill. Section 3. Decoding your pain clues, investigating the scene.
Okay, this is where you get to play detective with your own body. And this brilliantly illustrates exactly what the location of your pain is trying to tell you. Location is everything here. If the pain is in the front, around or below the kneecap, you're likely looking at runner's knee or patellar tendonitis, also called jumper's knee. If you feel inner knee pain when bending, that strongly points to an MCL injury or a medial meniscus tear. Outer knee pain, as we just saw, is almost certainly IT band syndrome. And if that pain or pressure is directly behind the knee, it's very often a Baker's cyst, which is just a fluid-filled sac that forms when excess joint fluid builds up. But it's not just where it hurts. The actual sensation matters just as much. Sharp, stabbing pain that feels incredibly sudden and intense, that usually points to acute structural damage, things like meniscus tears or sudden ligament sprains. On the flip side, if you're dealing with a deep, dull, burning throb that just kind of hangs around during and after activity, well, that's the classic signature of a chronic condition like osteoarthritis or long-term wear and tear.
Section 4. Finding relief at home, the resolution protocol. All right, let's pivot entirely to the actionable stuff. Here is your clear 4-step conservative treatment roadmap to reduce inflammation and get that stability back. Step 1, rest and modify. Look, this doesn't mean hiding in bed all day. It just means swapping high-impact stuff like running for swimming or cycling until things calm down. Step 2, apply ice and heat. Ice it for 15 to 20 minutes to numb sharp pain and use heat before activities to loosen up tight muscles. Step 3, strengthen your muscles. This is absolutely crucial. Your quads and hips are the main support system for your knee. And finally, step 4, stretch regularly so tight muscles aren't pulling your joint out of whack. Now, prevention is a massive part of this. Check out this mind-blowing fact. Every single pound of excess body weight adds an astounding 4 pounds of extra pressure on your knees with every step. I mean, do the math. Just 5 extra pounds means 20 extra pounds of force hammering your joint. Maintaining a healthy weight is a total game changer. Also, check your gear. Athletic shoes lose their shock absorption, so make sure you're replacing those running shoes every 300-500 miles. Protect those joints from the ground up. Section 5. When to see a doctor. Calling in the experts.
So the crucial point is, when is home care just not enough? You absolutely cannot ignore these red flags. If you physically cannot bear weight on your leg, if your knee suddenly buckles or gives way when you try to walk, or if you're seeing a visible deformity and severe swelling, you need immediate medical attention. Also, if that joint pain comes with a fever, redness, and warmth around the knee, those are signs of potentially severe complications. Call in the experts right away to prevent long-term joint damage.
And hey, if you do need to see a doctor, know that the medical toolkit we have today is incredible. If your injury is a bit too complex for home healing, they might prescribe targeted physical therapy. They can even do hyaluronic acid injections to literally lubricate an arthritic joint, or PRP injections to jumpstart natural tissue healing. And for severe structural damage, minimally invasive arthroscopic surgery can clean out the joint and get you moving freely again.
We've laid out the mechanics, lined up the usual suspects, and decoded the clues. Whether it's a dull ache from old shoes or a sharp stab from a torn meniscus, your body is trying to tell you something. So I'll leave you with this. Is it time to stop ignoring your knee? Don't let preventable pain dictate what you can and can't do. Take these clues, take action, and let's get you back to living pain-free. Thanks for joining me on this explainer, and here's to healthy, happy joints.